My name is Dr. Thomas Prebish, and I graduated with honors from Michigan State University for undergraduate, and then I also went to Michigan State University College of Osteopathic Medicine. Well, I've done a lot of different things in Battle Creek, Michigan growing up. I've worked in a factory in the corporate setting, and it wasn't until I volunteered at our local hospital that I got to see how well patients can do and how you can enrich their life. It's really rewarding, and that's when I knew I wanted to do medicine, and specifically surgery, as a career choice. Early on in my career, before I was in medicine at all, I was just volunteering at the hospital, and I was spending time in the emergency department, I was spending time in the clinic, and I was spending time on the hospital wards. But it wasn't until I got into the operating room and see the surgeons making that immediate direct impact where someone is at one point and you moved them to this point, and seeing that incredible growth in such a short time, it was very exciting to see that, and I knew I wanted to be a part of it once I saw that. My care philosophy is one that's conservative and holistic, because not everybody that comes through my door is going to need surgery. So the people that do need surgery, I try to provide them surgery that's contemporary, conservative, evidence-based, and I use techniques that are minimally invasive and robotic. So there are several procedures that I really care about. Most of them are on the robot, and the three that I like to do are hernia surgeries robotically, colorectal surgery, and bariatric surgery. And the reasons is for hernia specifically, it's much better than traditional open surgery for patients because you have less pain, you have quicker to return to work, and quicker to return home to family, and you also have less complications when compared to traditional open surgery. For colorectal surgery, traditionally, the patients are in the hospital for several days recovering, getting return of bowel function, but for minimally invasive and robotic, it dramatically cuts that down. You have decreased pain, decreased opioid use, and they're returning to work and to home a lot faster, and that's why it's great for colorectal surgery. And then for bariatric surgery, robotics is great because you have advanced 3D optics, so you're having a much better view compared to traditional 2D laparoscopic surgery. And then also with the advanced arm techniques, with traditional laparoscopic, it's more like chopstick instruments, but with the bariatric, you have wristed instruments, so it's much more precise at a microscopic level. So the most rewarding thing about my job is working with different families and seeing someone who's coming into the hospital at their worst hour. They're sick, they're confused, they don't know what's going on, and the best thing is helping them get better and watching them grow in the hospital and being able to interact with their family and seeing them come from their worst state to their best and seeing them be the person that they're meant to be. It's an amazing feeling, and it's great working with the whole team in the hospital. It's really rewarding.